I knew it wasn't right the way I was feeling. I just knew I had to do something. I wanted to get fixed tomorrow. I didn't realize I had arthritis in my hip. I couldn't lift my leg up. So I went to physical therapy for a while and it got better. And then all of a sudden it got worse and I couldn't get in my car. Nobody wants to have surgery because you can't anticipate the pain, but it was truthfully a breeze.
One of the rewarding parts about doing joint replacements is that we can really see almost immediate improvement, hips especially. I'm amazed at how someone will come in with a bad arthritic hip and we replace it, and just later that day after surgery, they say they feel better than before surgery.
Within a very short period of time, just days, you're actually moving around without using a walker or a cane. I think I've sent at least 3 or 4 patients to him that have gotten new hips. From the front desk people to his nurse, you feel like you're among friends, which is what I really liked. He's got great bedside manner. He's just a very pleasant man. I think the care is top-notch. I feel normal. I love the way I feel.